Michael Millenson. I'm a patient activist, I'm a consultant, and I'm an adjunct faculty member at Northwestern University's medical school. I have never had anything bad happen to me personally. My advocacy role is to stir things up and to say the things that the experts won't say in public about money, about failure, about ego, and to bring in the evidence from the literature and the evidence from what happens to people in real life and stir things up and cause change. That's what I do in a way that really is somewhere between people telling personal stories and the guys writing academic articles. Very simple. Grab them by their wallets and their hearts and minds will follow. Money motivates. People say it doesn't, but as you can hear every speaker, it does. You have to show people that it's in their self-interest to change, and then they will change. Money, publicity, the culture, all that comes down to having people change, and people do not change, even with the best of intentions, very easily until it's in their interest to change. Change the payment system, change how people shop, change how people are paid by big third-party payers, change how people are measured, and behavior changes. That simple and that difficult. To me, one of the most important things is not forgetting the human part of healthcare, and that's why when people talk about patients as consumers, that's ridiculous. When you're sick with cancer, you're not a consumer. People talk about consumerism, empathy, understanding the vulnerability that people have, understanding how you can take care of people as well as empowering people. That's really the most important thing. You can't treat healthcare like it's an industry. It's not that. And while you have to have the right financial incentives, you absolutely have to have the right financial incentives, just as important is not forgetting to appeal to people's sense of mission. Just as important is understanding that healthcare is special, that what providers do is truly something that's holy. And so while I'm hard on the providers, it's also because it's a holy mission and they need to fulfill it. And so those two sides, remembering the empathy, remembering the humanity and vulnerability of the sick, we can't forget that as we celebrate data. To me, the most difficult thing is waiting for the changes we all know should happen to actually happen. You hear people talking about variability in clinical performance. That was the subject of big congressional hearings and headlines in 1984. Variability in clinicians, we can't put up with it. When will we change? How quickly will we change? How quickly will data visibility and payment changes and culture change what we know has to change? And to me, that's what's haunting, is the patients who are hurt and sick and die unnecessarily because we don't do what we know how to do. Not the great breakthroughs that everybody talks about, the war on cancer, yeah, all that's important, but doing what we know how to do today to make care safer and better and more effective and more efficient. That's kind of what haunts me and where I hope that we're gathering momentum.